Hello, this is Dr. Reddy from Seven Oaks Pet Hospital, Wesley Chapel, Florida. This is Thursday again, 12 noon, and today I'm going to discuss about Hermione Duncan Reddy Foundation. We had this foundation for a long time, uh, almost I would say probably a couple years or so, and the reason we got this foundation, Reddy Hermione Duncan Reddy Foundation is over the past 15 years I've been in practice. We had on a daily basis we had so many clients who come to our practice and not able to pay for the services we were going to offer, and the pets were in pain or pets were suffering. So in those situations, we were basically giving them discounts from the practice and treating them 100% from our own in-house funding, and that was going on for almost 10 12 years. I was doing it as a good Samaritan, to not to have those pets suffer. But as things gotten busier with us and we started seeing a lot more patients on a daily basis where clients are not able to afford, we were not able to completely fund every pet walks into our door. And like I said in the last few of our Facebook lives, that no pet gets untreated is what we want to go with it. Whoever comes to Seven Oaks, if they show that they have a financial restrictions and they can prove that to us, we would definitely do anything, everything for that pet to save that pet and help the owner. So that is the philosophy we are going to, or we've been following at Seven Oaks Pet Hospital. So in order to fit that, we started having Hermione Duncan Reddy Foundation, and the story behind that, Hermione was our first cat when we opened uh, 2007, and it was a stray cat. Somebody dropped Hermione out at our office, and we started really nurturing that kitten. It was 3 months, 2 months old kitten. So our team was nurturing, and then after 3 4 months, we figured out that the kitten has some issues with the bone growth, that the bones were rubbery, and so she started having a lot of medical issues. So we were trying to treat every day, but again, we were able to save that cat maybe a year and a half, and after that we lost that kitty. And that was one of our favorite cats we ever had. So that's how the Hermione, and the cat's name was Hermione at that point. So we came with that name for Hermione. And Duncan has another great story. Duncan, a lot of people know Duncan because that cat we had for almost 12 years, I think, and he was the best cat we had. He pretty much run the whole hospital, and he didn't care about dogs. He didn't care about anything. He just was. He was one of the prettiest cats too we had at that point. And the story behind Duncan was he came to us. I was the doctor, I think, at that point, and he came to us and with peeing blood, and we did X-rays, blood work, and we found a stone in the bladder. Owner could not afford, and she wanted us to euthanize the cat, and we declined to euthanize, and we took the cat. And then we started working on the cat. One of our doctors did the surgery on the cat, and then we saved the cat, Duncan, and Duncan stayed with us forever after that. And he was face of our clinic, and unfortunately he passed away in 2016, 2017. So so that's how the name Duncan came in. So Hermione Duncan and Reddy Foundation, as Reddy is my last name, so that's how we came with that name of the HDRF Foundation. So, like a lot of foundations or non-profit organizations are dependent on donations, but here for Hermione Duncan Reddy Foundation, we decided that we want to make that foundation self-sustaining. I see two people said hi, Dr. Kota and hi Jen. Thank you for joining. Um, so, in order to make that Hermione Duncan Reddy Foundation self-sustaining, we as a team came up with an idea. One is to have our Pet Vet Express, like our ambulatory service. You guys all see that van parked outside our clinic, and we use that to drop off the pets or drop off the food or pick up the pets. It's an ambulatory service which has a capable to do oxygen and everything too. If we have to transport it to any other local emergency facilities, we can do that, or we can do house calls with that, or Pet Vet Express. So all the money Pet Vet Express generates, we generally put that money back into Hermione Duncan Reddy Foundation, and that money we use back to our clinic to support any of the pets which can be financial distress or any other reasons owner can't afford to treat. And then the second thing what we did was, again, that was a great idea. Our team came up with that idea, and which is vending machine, which again you guys see it up front sitting, which has all the drinks, soft drinks, and some snacks and everything. And any money we generate from our vending machine, that also goes to Hermione Duncan Reddy Foundation. So partially whatever the money comes from donations, we do ask for donations, we do get donations, and during COVID time it has been really difficult because we really can't go out and do some community things, so we've been trying to stay indoor as much as possible. But whatever the clients are donating money, we put that in foundation, and any money we get from Pet Vet Express and vending machines, we put that back into the Hermione Duncan Reddy Foundation too. But unfortunately, the money is being drained so fast out, we are not able to fill it back in. So that's another reason we are talking today, is what else we can do to get more funding into Hermione Duncan Reddy Foundation, so we can help a lot more pet owners. I have a lot great stories about how we have helped over the past 1 year. I think I remember last 7 or 8 stories which actually sticks in my mind, how Hermione Duncan Reddy Foundation stepped up and helped those pets. If we did not, those pets would have actually been euthanized, I feel like. So there's one nice story. A cat named Patty, if I remember correctly, was attacked by a dog, and a lot of bite marks and all over the body, and the owners just walked in, and I think I was the doctor on that patient, and I saw the dog, I saw the cat, and then looked at it, did the exam, and I think I found probably a lower jaw was broken in that cat, and a lot of puncture wounds. So we did X-rays, blood work, and everything, and owners were not able to afford all that stuff. So we had to have a Hermione Duncan and Reddy Foundation pitch in some money, and then we put them on some little bit of a payment plan, whatever they can afford to do that. And then at the end of the day, we wired the cat's jaw, and cat started doing well. After 8 weeks, cat is amazingly doing well, and owners were happy, and we could save that cat. So it all happened, I think, with the help of Hermione Reddy Foundation. Otherwise, that cat would have been euthanized that day. Then there was another good story I know about a dog which came to us a few months ago. Last year it was. The dog's back leg was actually had a big laceration wound on the dog, and dog's name was Sophie, I think, if I remember correctly. And she had laceration, and when the owner brought in, and she said, she wanted to treat that infection, but when we looked at it, one of our doctor looked at it, said, this dog would need surgery and all those things. And what the owner told us was she was actually chaining the dog in their backyard. So we definitely didn't want to give the dog back to her, and I think we were going back and forth. And then I think our owner suddenly disappeared from the clinic, and we didn't see her after that. And we kept the dog in the clinic for almost 8 to 12 weeks and treated that leg every day, bandaging and medications and all that stuff. So we nourished it back to normal, and the leg is completely healed. And then one of the Good Samaritan adopted the dog, and now Sophie has a good life, and she's happy with the new owner. So that again happened with the funding from our Hermione Duncan Reddy Foundation. So which is again another great story. And then we had another dog attack by an unknown animal. I think it happened, and then they came from actually out of town. I think I'm going to say probably 30-40 miles, because nobody else was helping them, and they came here on a Saturday, if I remember, and I think I saw the dog that day, and the dog's bone was actually protruding from that fracture area, and it's a beautiful dog. I think it was a pit bull or so. and nobody was willing to help. So we again took the dog back and did some x-rays, some treatment on the dog, and put them on some Hermione Duncan Reddy Foundation didn't have much money because that dog needed a lot of money to get the treatment done. So we started a GoFundMe website, or a site for that owner, and we collected some money. And in the end, I mean, after 6-8 weeks, the dog's leg got completely back to normal, and she was able to keep the dog. So that was another great success story. And I have lots of stories I can tell you. On a weekly basis we see those, and those are all because of Hermione Duncan Reddy Foundation. Is one of the main reasons those dogs are alive to this date, I think. So what I'm trying to say is that Seven Oaks Pet Hospital, we do a lot of things. Like I said, we have a Hermione Duncan Reddy Foundation, we have a Pet Vet Express, we have which is an ambulatory service, then we have a Pet Urgent Care, which helps for clients who need overnight, I mean not overnight, after hour care until 11 p.m. So that helps them save a lot of money. If they go to other places, they could end up paying a lot more money. So we try to help the clients that, and then they don't have to drive all the way from North Tampa to Tampa area, I mean middle of the Tampa or downtown Tampa, which is pretty far, 30-40 minutes drive considering when you have an emergency sick pet with you. And then we do have at Seven Oaks Pet Hospital, we do have a lot other opportunities for clients to save money when we do ultrasounds, when we do all these laparoscopic procedures, when we do all these major surgeries. Clients are saving anywhere from $500,000, $2,000 depending on the procedure. So that's our idea is to save animals as much as possible by keeping the cost low. That is what we want to do. But at the same time, I'm sure there are clients or circumstances for clients come up where they need some help temporarily or sometimes in the long term. So that's where we have our own in-house payment plans, or Hermione Duncan Reddy Foundation. Like I said, that is the reason we opened this foundation, so we can promote no pets who walks into our doors gets untreated. That's what we want to do here at Seven Oaks Pet Hospital with the help of these foundations. And that also helps, I think, not only the clients but also for us as a profession. We want to save every animal walks into our door, not worry about the finances. So anytime we put a dog down because of the financial reason, that makes our day pretty stressful, and we all are distraught and distressed because we all think that what else we could have done to save this dog. The question asked by Sandhya is how do we donate for the foundation? Yes, we have a website. It's called the hdrf.com. I think maybe Emily can put it on here. The website name. It's a nice, cute little website. We designed it without spending too much money on it, as it's a non-profit. But at the same time, we want people to understand what our motto is on that foundation, and there is a donate button. They can go and donate the money if people want to do that. And we would definitely appreciate any donation. Even a dollar donation would be, it goes long ways. So that's about the Hermione Duncan Reddy Foundation, and we want to continue this foundation work. Hopefully this year, when things start opening up, we can do a lot more community works where we can go and raise a lot more funds. And I'm open for anything, if somebody calls me for any low-cost vaccine clinic and they tell me that they'll donate some money to Hermione Duncan, I'll be ready to volunteer my time to do that, so that the HDRF can make some we can get some funds in there, so that can be used for future pet owners. And again, the pet owners have to qualify. Our in-house financing or Hermione Duncan Reddy Foundation show that they have a financial difficulty, show that they are not able to get care credit or scratch pay payments. They are not able to qualify for that. Then based on that, we as a team decide that if this pet would be a good fit for our foundation money. So that's how we do here. And again, we try to help on an average 4 or 5 patients a month at least, or as many patients as we can. But that is what we have been averaging. So hopefully we will continue to do this on the long-term basis, and would ask for help as much as you guys can give, or any out of the box ideas. If anybody has, please feel free to let us know or email us, and we would be glad to work on it. Alright guys, thank you so much for joining today for this Facebook Live Foundation. And we will do another Facebook Live next Thursday, same time, 12 noon. Please don't forget to join. Thank you guys, and have a great day. Thank you. Bye bye.